What causes word-finding issues in CFS brain fog? Have you ever struggled to find the right words when speaking or writing? This is a common experience for many people with chronic fatigue syndrome, often referred to as brain fog. So, what exactly causes these word-finding issues in individuals with CFS? Word-finding difficulties in CFS stem from cognitive impairments that affect how we process language, retrieve memories, and the speed at which we can think. Brain fog in CFS is characterized by problems like impaired concentration, slowed cognitive function, and challenges with short-term memory. All these factors contribute to the struggle of retrieving the right words during conversations or even when thinking. When we talk about word-finding problems, we refer to the difficulty of accessing vocabulary stored in our memory. Even though we know the words, it can feel like they are just out of reach. This can lead to the frustrating sensation of having words on the tip of the tongue. You might notice increased pauses during speech, using vague language, or having trouble organizing your thoughts into clear sentences. These symptoms highlight disruptions in the brain's neural networks that are responsible for language production and retrieval, rather than a loss of language ability itself. The reasons behind these language impairments in CFS are complex and involve several factors. First, cognitive slowing and reduced processing capacity play a significant role. Many people with CFS experience slowed information processing speed and mental fatigue, which makes it harder for the brain to quickly access and produce words. Another factor is working memory deficits. This refers to the difficulty in holding and manipulating information in short-term memory. When this ability is compromised, it can affect how we formulate sentences and retrieve specific words. Neurobiological changes also contribute to these challenges. While researchers are still studying the exact mechanisms, CFS is associated with altered brain function. Changes in areas related to attention, memory, and language networks can disrupt normal language processing. Additionally, mental fatigue and cognitive exertion can worsen symptoms. Post-exertional malaise, a hallmark of CFS, often leads to increased cognitive difficulties after mental effort, further impairing word retrieval. These language problems in CFS are similar to those seen in other conditions that involve brain fog or cognitive dysfunction, such as fibromyalgia. Patients in these conditions often report difficulties recalling names, constructing sentences, and understanding language nuances. In summary, word-finding issues in CFS brain fog arise from a mix of slowed cognitive processing, challenges with working memory, and neurobiological disruptions affecting language networks in the brain. These factors together impair the ability to retrieve and produce words efficiently, leading to the communication difficulties many experience. Understanding these mechanisms helps clarify why brain fog in CFS includes significant language and word retrieval problems. It also emphasizes the importance of cognitive rest and pacing to manage these symptoms effectively.